Bismillahirrahmanirrahim. Good morning. We are discussing coronary heart disease for the previous 3 days for these yellows, and we know that coronary artery disease is a demand supply mismatch problem. It is becoming extremely rampant in the UK as well as worldwide, caused by atheroma and its complication, and further complicated by thrombosis. Maybe stable, unstable angina, infarction, heart failure, arrhythmias, and sudden death as manifestation. Coronary artery disease basically is atherosclerosis, which is itself a widespread inflammatory disorder, can affect any artery territory, having 6 stages. Fifth and sixth, the most dangerous, and the inflammation, lipid accumulation, smooth muscle cell migration, plaque instability, rupture, thrombosis in vulnerable plaques can lead to many complications. However, there are some stable plaques as well because of atherosclerosis. We discussed risk factors of age, gender, family history, smoking, hypertension, hypercholesterolemia, and diabetes mellitus, along with physical inactivity, obesity, alcohol intake, diet deficient in fresh fruits and hemostatic factors, along with social deprivation. The lifestyle recommendations like no smoking, exercise, reducing BMI, balancing diet, and healthy habits, population strategy, individualized strategy. We came to know that there is a risk stratification strategy in which individualized risk lead to treatment modalities for a person, and such risk assessment, absolute risk assessment, will guide treatment decision, and high risk persons will benefit from aggressive interventions. Low risk patients will not require aggressive intervention. There is a score, it is called score 2, and it's a risk calculator, and we can know how much is the chance of cardiovascular disease in an apparently healthy person. And there are key factors that are utilized in this scoring. Age like 40 to 69, 70 plus go for score 2 of gender, male or female, smoking status, current smoker, non-smoker, systolic blood pressure, total cholesterol and HDL cholesterol along with LDL cholesterol. Specialized versions are score 2 of for 70 plus, incorporating diabetes status, and score 2 diabetes is for patients with type 2 diabetes. Calculator will combine these factors, adjusting for competing risks like non-cardiovascular death and regional rates. And European clusters are low, moderate, high, and very high to provide personalized score for fatal and non-fatal heart events, myocardial infarction and stroke. This is the website. It shows, you can see, calculate the 10-year risk of fatal and non-fatal cardiovascular disease. And here is the interface: low risk, moderate risk, high risk, very high risk. And you can calculate that risk from here. Alternatively, you can go to this website and directly calculate the risk. So we can move to that website, and as you can see, this is the risk score, systematic coronary risk 2 evaluation. We take example of a patient who is a male. His age is 65 years. He is currently smoking. His systolic blood pressure, we enter 165. His total cholesterol 230. Is HDL cholesterol 30? Is risk region. So you will see the evidence for definition of risk region, and these are the model coefficients and risk regions. You can see scale low, 1, 2, 3, and 4. 1, 2, and for male, 4 interface, 4 scales types, 2 for males and 2 for females total. And you can check on this. We put this patient in high, and the risk comes out to be 28.4%. And we cannot put it in low. Still, it put in that category risk region. Still, he is having 16% risk. So it is a high risk case as we previously discussed, and the coefficients are given for each attribute. This is the risk regions by the map. You can see low risk, green areas, moderate risk, and very high risk. And we have not been mentioned in it, but our country is somewhere moderate to high risk. Should not go for very high risk on without considering the factors. And this is the literature behind all this risk score. So hopefully you have got a grasp of what are the different factors in calculating systematic coronary risk evaluation score 2. And this is used whether we will go for aggressive therapy or would go for no therapy in a particular individual.